Have you ever wondered what actually happens inside the body during sex? Most people know the basics: arousal, erection, climax. But the reality is much more fascinating. The penis goes through several distinct stages, each influenced by hormones, blood flow, nerves, and even your mindset. Welcome to the Healthy Body. Dr. Alex here. Today we're diving into what really happens to the penis at different stages of sex. By the end of this video, you'll understand the entire process from the first spark of desire all the way through resolution. And more importantly, how you can support these natural reactions at any age. Before we begin, if you enjoy clear, science-based health tips for energy, intimacy, and healthy aging, make sure to subscribe. That way, you'll never miss an episode that can help you feel and perform your best. Stage 1. Desire and arousal. This is where everything begins. You see, hear, touch, or even imagine something stimulating. Your brain reacts first, sending signals through the nervous system that trigger the release of dopamine, the anticipation chemical. As arousal builds, the brain also reduces signals from the sympathetic nervous system, the part that usually keeps blood vessels tight. This allows penile arteries to relax. Picture it like opening floodgates. More blood flows into the spongy chambers of the penis, causing swelling. At this stage, you may notice partial erection, warmth, and heightened sensitivity. For some men, this stage is quick. For others, especially as we age, it can take longer. Lifestyle factors like stress, fatigue, or alcohol can all influence how smoothly this stage unfolds. Engagement question. Have you noticed differences in how fast or slow arousal begins for you at different ages? Let me know in the comments. Your experience might help someone else. Stage 2. Full erection. As stimulation continues, more blood flows into the erectile chambers. Veins that normally drain blood away are compressed, locking it inside. This is what gives rigidity. The penis increases in both size and firmness. This stage is heavily dependent on vascular health. Conditions like high blood pressure, diabetes, or smoking can interfere with this process by damaging blood vessels. That's why sexual function is often seen as a reflection of cardiovascular health. In fact, many doctors call erectile changes the canary in the coal mine for heart problems. Here, testosterone also plays a role. Adequate levels support libido and help maintain erectile tissue. Without balanced hormones, arousal may not fully transition into a firm erection. Think of this stage as a finely tuned orchestra. Nerves, blood vessels, hormones, and psychology all working together to create harmony. Stage 3. Plateau. After erection, the body enters what's called the plateau phase. Blood pressure, breathing rate, and muscle tension rise. The penis is fully erect, often with increased sensitivity. The testicles also draw closer to the body in preparation for ejaculation. Mentally, this stage can be both exciting and fragile. Anxiety, distraction, or performance worries can interrupt the process. That's why mindfulness, relaxation, and connection with your partner are so important. Fun fact: this stage can last just a few minutes, or quite a while, depending on stimulation and arousal control. Some men practice techniques like edging, which prolong this plateau and delay orgasm for greater intensity later. Stage 4. Orgasm and ejaculation. This is the climax most people think about, but it's actually two events. First comes emission. Contractions in the reproductive tract move semen into the urethra. Then comes expulsion. Rhythmic muscle contractions release semen outward. The penis often feels pulsations during this phase, and the experience is accompanied by a rush of oxytocin and endorphins, chemicals that create feelings of pleasure, bonding, and relaxation. Interestingly, studies show that orgasm also reduces cortisol, the stress hormone. That's one reason why sexual activity can leave you feeling calmer and more connected afterward. Stage 5. Resolution and refractory period. After orgasm, the body begins to return to its baseline state. Blood drains from the penis, leading to detumescence, the medical word for the penis softening. Heart rate and breathing gradually normalize. For men, there is usually a refractory period, where the body cannot immediately achieve another erection. The length of this period varies. In younger men, it may be minutes. In older men, it can be hours or even days. Factors like sleep, diet, and cardiovascular health influence recovery time. This is a natural, healthy process, not a sign of weakness. In fact, the refractory period allows the body to rest and reset. Have you noticed changes in your refractory period as you've gotten older? How has that affected your experience? Share in the comments. Let's pause for a quick recap of what we've covered. N desire stage begins in the brain with dopamine and nerve signals. N full erection depends on blood flow and hormones. N plateau raises tension and prepares for climax. N orgasm involves emission and expulsion with a release of feel-good chemicals. N resolution resets the body with a natural refractory period. The key message? Every stage is natural, interconnected, and influenced by both body and mind, supporting vascular health, balancing hormones, and caring for mental well-being can enhance each phase of the sexual response. So whether you're in your 30s, 50s, or beyond, remember, sexual health is not just about the mechanics. It's about the whole person, your circulation, your hormones, your mental state, and the connection you share with your partner. If you found this breakdown helpful, be sure to subscribe for more science-backed health insights. We cover everything from circulation to hormones, energy, and intimacy. And if you'd like to keep exploring, our next video will dive into natural ways to boost blood flow and stamina, a topic that ties directly into what we discussed today. Stay healthy, stay curious, and take care of yourself, because you are absolutely worth it.